Hi guys, this is Ms. Romani once again, and this week we will learn a little bit about cardiovascular medicine and heart disease. In this lesson, we will explore the causes of the most common cardiovascular conditions, as well as some of their available treatments. So now let's start by becoming familiar with the heart. Here's what a beating heart looks like. The heart is a muscular organ roughly about the size of a closed fist, and as the heart contracts, it pumps blood around the body by pumping deoxygenated blood to the lungs where it picks up oxygen, and then pumping that oxygenated blood that came from the lungs out towards the body tissues. Now, when we're talking about cardiovascular disease, we're not just referring to just a single disease. It's actually a group of diseases which affect about 1.3 million Canadians. And these diseases involve the heart, the blood vessels, and the blood vessels that feed the heart itself. And so let's begin by looking at some of the risk factors that could increase someone's chance of developing any of the cardiovascular diseases that we will discuss within this lesson. So there are 7 general risk factors that can increase someone's risk of developing heart disease. There's actually even online calculators that can be used to calculate someone's 10-year risk of stroke or heart disease, and it depends on the presence or absence of the risk factors that I'm going to mention. So let's begin with one of the greater risks, and that is diabetes. Either type 1 or type 2 diabetes is a high risk factor of cardiovascular disease. Another is hypertension or high blood pressure. Hypertension can cause thickening of the blood vessels and inflammation, which can then lead to heart disease. Age is also a factor. The older you are, the greater the risk. So is gender. Males tend to have a higher risk of heart disease than women of the same age, with the exception of postmenopausal women. After menopause, the risk for women for heart disease is equal to that of men of the same age. So for young women, the risk of heart disease is lower than for young men, but for older women after menopause, the risk for them for having heart disease is the same as men of the same age. And then another risk factor is cholesterol. One of the things that doctors will check during a physical sometimes, especially as you get older, is your cholesterol level. And in particular, an increase of LDL cholesterol, considered to be bad cholesterol, and decrease in HDL cholesterol or good cholesterol are both indicators or risk factors for cardiovascular disease. Sometimes cholesterol levels are a result of dietary choices. However, there is also a condition that is genetic that can lead to people having high cholesterol or high LDL cholesterol despite of any dietary choices. And this is a condition called familial hypercholesterolemia, which can lead to people having high LDL cholesterol. So speaking of genetics, there's also a family history of heart disease, which can also be a risk factor for developing cardiovascular disease yourself. And last, smoking. Smoking tremendously increases the incidences of cardiovascular disease. So what all of these risk factors do is they basically increase the chance of a patient developing a condition known as atherosclerosis. Atherosclerosis is by far the most common underlying cause of cardiovascular disease. It is a condition of the arteries. Healthy arteries are flexible and elastic. Atherosclerosis basically refers to a slow buildup of something called plaque that builds up on the inside of the artery walls. Plaque is a mixture of fats, cholesterol, and other substances, and it causes the artery walls to harden, the opening to narrow. And so this is another reason why atherosclerosis is sometimes called hardening of the arteries. So when you have healthy arteries, they're elastic. When you have atherosclerosis, your arteries become less elastic. They become hardened, less flexible. Also, the plaque builds up inside the artery and it narrows the space through which blood can flow, so that restricts blood flow. And when it gets really bad, the plaque can also burst, and the bursting of the plaque can actually trigger blood clots to form within the blood itself, which can then cause strokes and heart attacks and other cardiovascular conditions that can be life-threatening. Let's take a look at how this progressive condition develops, because it doesn't form overnight, it forms over time. So let's take it step by step and let's go through the process of the development of atherosclerosis. And it always starts with some sort of damage to the interior walls of the arteries. This damage can be caused by smoking, by high levels of cholesterol, by hypertension or high blood pressure, by other triggers. So it starts with damage to the artery wall. And the damage to the artery wall is going to trigger LDL or low density lipoproteins lodging into these damaged artery walls. And so that begins the formation of that plaque as that LDL cholesterol lodges inside the damaged artery walls. And once that happens, white blood cells will then penetrate the artery walls and will start to accumulate there. The next step is something called foam cell formation. In this case, foam cells are formed when white blood cells start to eat or ingest the cholesterol, the fatty material that is now lodged inside the artery walls. And that forms this fatty deposit that has a foamy appearance because you have the white blood cells that have basically been consuming all this lipid. And then inflammation and the fatty deposits are going to cause this damaged artery wall now to develop scar tissue. And that's going to lead to the development of a more fibrous tissue called collagen. And then calcium will be deposited within there as well. And that's going to now form a very hardened, very scarred material, which is this thick plaque. And that is going to cause the artery to narrow and to stiffen. And then if the plaque ruptures, that can lead to blood clots forming within the blood vessel itself. Now, this was a simplified account of how atherosclerosis forms. There's more steps to this, and if you ever go into a medical field, you will probably learn a little bit more of sort of the chemical reactions that occur within the artery wall themselves that also lead to the formation of the plaque, as well as there's things like oxidation that are happening, free radical formation. So we're not going to get into all of that. So let's take a look at now what happens when this plaque forms. Someone has developed atherosclerosis. Now, what are the conditions that can occur as a result of that? And let's start with something called angina. Angina is not actually so much a disease as it is actually a symptom of a problem with the blood flow to the heart, especially blood flow to the heart muscle. Essentially, angina is chest pain. It happens when the heart doesn't get as much blood and oxygen as it needs. And that is because the coronary arteries, these arteries right here that supply the heart muscle itself with blood, become clogged with the plaque that we discussed in the previous section. When atherosclerosis develops in the coronary arteries, those arteries that are basically feeding the heart muscle itself with oxygen-rich blood, that can then lead to reduced blood flow to the heart muscle, which can lead to chest pains depending on the severity of the blockage or the narrowing. There's actually two types of angina. There is what is called reversible or stable angina, which happens only when the heart works really, really hard and needs more oxygen. So, a person would feel fine, and then maybe they're exercising or they get really, really angry and their heart needs to start pumping much harder. It needs more oxygen. And now because there is a decreased supply of oxygen to the heart muscle itself, because those coronary arteries have plaque, then the heart muscle starts to hurt. And you feel there's a pain that comes from the reduced blood flow to the heart muscle. Another type of angina is what is called progressive or unstable angina. And this happens when the plaque in the coronary artery actually ruptures. Remember, we discussed earlier that sometimes the plaque itself can rupture, and that can lead to the formation of blood clots within the arteries themselves. And then that actually puts the patient at increased risk of heart attack. So angina is chest pain, but it could be an indication that the patient is at a very high risk of developing a heart attack if the condition progresses. A heart attack happens when blood flow that brings oxygen to the heart muscle is severely reduced or stopped. Why would oxygen be stopped from reaching the heart? atherosclerosis. When atherosclerosis becomes really severe and pieces of plaque start to break off, and that essentially leads to the formation of blood clots, then one of those blood clots can block one of the coronary arteries that feeds the heart muscle. When this happens, the heart muscle can be deprived of oxygen and it can die. The extent of the damage depends on the amount of tissue that is deprived of oxygen and the size and the severity of the clot itself. But essentially, a heart attack or myocardial infarction is heart death. Part of your heart dies, not the entire thing, but the part of the heart that is no longer being fed because of a blood clot that is blocking blood to that area. And so a heart attack is a circulation problem. It's a problem with blood flowing to an area of the heart. However, a heart attack can actually cause what is called cardiac arrest. And that's an electrical issue that causes an irregular heart rhythm, something called an arrhythmia. And that can stop the heart from pumping blood to the body. And this is life-threatening. And this is why CPR is then given to someone undergoing cardiac arrest, because it helps the heart start pumping blood to the rest of the body. Now, another and more effective thing that you can do if it's available is quickly shocking the heart with what is called an automated external defibrillator. And that can save the person's life. A defibrillator can restore that normal heart rhythm that has been stopped by the cardiac arrest. And the faster it is used, the better. Preferably within the first 5 minutes, the greater the chance of survival. So studies have shown that if you administer or use a defibrillator on someone who is undergoing a cardiac arrest within 5 minutes, their chances of survival could be up to 80%. And this is why places now have defibrillators available. Hockey arenas, schools, and any public space have now these defibrillators, because if somebody undergoes cardiac arrest, the faster you get to them, the better. And cardiac arrest is not only happening when someone has a heart attack. It can happen for a variety of different heart conditions that basically causes electrical malfunction within the heart. Now, a patient who survives a heart attack will be very weak afterwards. The heart muscle that has been damaged by that lack of blood flow will form scar tissue, which will weaken the heart muscle itself. And heart muscles will heal, but it can take months for them to heal. And of course, the severity of the heart attack will determine the speed of recovery. It's important to be able to recognize the signs of a heart attack. Because of what we see in movies, most people think that the only sign of a heart attack is sudden chest pain. But now we know that heart attack symptoms aren't always that clear-cut. And not only that, but interestingly, heart attack symptoms are very different between men and women. There was a study that was published in 2003 that indicated that for women, the most commonly reported symptoms didn't even include chest pain. Instead, women actually reported more often that their main symptoms of that heart attack was extreme unusual fatigue, sleep disturbances, and anxiety. So it's important that we are aware of what these symptoms are, because the sooner you seek medical treatment, the greater the chances of survival and decreasing the chances of damage to the heart. Now, let's move away from the heart and let's take a look at other cardiovascular issues that can be life-threatening. In particular, let's take cardiovascular issues that can affect the brain. One of them is something called TIAs, or transient ischemic attacks. When atherosclerosis affects the arteries that supply the blood to the brain, it may cause some of these transient ischemic attacks, also referred to as mini strokes. A transient ischemic attack basically occurs when blood flow to parts of the brain is stopped for a short time. And the symptoms are pretty much the same as a stroke, but they don't last long. So just like angina can kind of serve as a warning for a heart attack that may happen in the future, a TIA is basically a warning that you may develop a stroke in the future. And early treatment can help prevent a stroke. So TIAs are essentially reduced blood flow to parts of the brain due to atherosclerosis in some of the blood vessels that feed the brain, or sometimes even blood clots. If it progressed to that point, you might actually have these floating blood clots that are transient. They don't get stuck, but they can block oxygen to the brain temporarily and then move on. But because of that, either reduced oxygen or the short amount of time in which oxygen does not reach the brain, the TIAs, or these little mini strokes, can lead to the same sort of symptoms as strokes, but only temporarily, and then they go away. And thankfully, they don't cause permanent brain damage, but they're a very clear warning sign that a stroke might be imminent. So the most common type of stroke is called an ischemic stroke. It occurs when an artery that is feeding the brain becomes blocked by a blood clot, and it's due to atherosclerosis, where the pieces of plaque break free and form the blood clots. Essentially, the same causes for a heart attack causes ischemic stroke, except that instead of being a coronary artery that is blocked, it is an artery that feeds the brain. And essentially, then the parts of the brain to which blood flow has been interrupted die, and that's due to the lack of oxygen. So a heart attack causes parts of your heart to die, the heart muscle to die. A stroke can cause parts of your brain to die. And unfortunately, with brain tissue, unlike the heart, it doesn't recuperate, and the damage is going to be permanent. Sometimes people can recover some of the functions of parts of the brain that have died, because other parts of the brain can sometimes take over those functions. Another type of stroke, which is actually less common, is something called a hemorrhagic stroke. Hemorrhage is basically a word that describes excessive bleeding. So a hemorrhagic stroke is actually caused by not a blockage of blood flow to the brain, but a weak artery that is weakened due to high blood pressure. And this ruptured artery causes now blood to form in the brain, and then that can cause also damage to the brain tissue. So once again, fast action is important. When dealing with a heart attack, we need to be able to recognize the symptoms so we can get medical intervention fast before cardiac arrest. For strokes, fast action is also important because, especially with ischemic strokes, if a patient gets to the hospital, there's medication that can be given. As long as you get to the hospital within 3 hours of the onset of symptoms, that can help break up the clot and reduce significantly any type of damage that is done by the stroke. So being able to recognize the signs and getting the patient to the hospital quickly is key. So there's a little mnemonic device: B fast, B for balance, person tends to lose their balance, E for eyes, blurred vision, F for face. Oftentimes one side of the face becomes droopy, and that's because whatever side of the brain is being affected by the stroke, the opposite side of the body will become affected. A is for arms or leg weakness, oftentimes one side of the body. Speech difficulty, and the last is just to remind you, hey, you need to make sure that you do this fast. You only have a limited amount of time to get to the hospital or call an ambulance in order to minimize the damage. Last, we're going to talk about something called aneurysms. And aneurysms are little tiny blood-filled balloons that bulge out in certain blood vessels and weaken it. And they can happen anywhere in the body, but they are more dangerous when they happen in the brain. And these are called cerebral aneurysms. But they can also happen in the abdomen, they can happen in the heart. Now, the aneurysm itself is just a blood-filled balloon. But the aneurysm is dangerous and life-threatening when it bursts open. And so a ruptured aneurysm can lead to hemorrhage and internal bleeding, and it can lead to death. And the risk factors of developing an aneurysm can include obesity, hypertension, high cholesterol, diabetes, smoking, but also trauma, like for example, injury can also lead to an aneurysm forming. They can also be something that you are born with, so they can be congenital. Some people are just born with sort of weakened blood vessels that can then form these little aneurysms or balloon-like bulges. And it can also be genetic. So people who there's a family history of aneurysms might be able to develop them as well. So what treatment options are available for the conditions that we just discussed? Well, in the next lesson video, we will cover treatments for cardiovascular disease as well as ways to prevent them. Talk to you soon.